Hey everyone, welcome to Revolutionary Health. I'm Charles Stevens, the founder and executive director of the Counter Narrative Project.
I'm David Malebranche, and I'm a human being.
You're a human being today.
Today,
Okay.
hmm
No doctor,
no doctor,
HNIC, none of that.
no
Okay.
HNIC. Not today.
Um,
Maybe tomorrow.
maybe tomorrow.
hmm
Okay.
Tune in tomorrow.
So we have a lot to talk about.
We do.
I'm sorry.
What you want to start with?
Well, first, let's start with if you're watching the Revolutionary Health on Facebook, please like us on Facebook. If you're watching us on YouTube, please subscribe to our YouTube channel. And finally, please join our email list at thecounternarrative.org. So, where do you want to start?
I think I want to wrap up. I guess this weekend, I want to give a shout out to Marvell Terry and the Red Door Foundation and the
Mm.
Saving Ourselves Symposium, which happened in Birmingham, Alabama. It was absolutely amazing. Marvell Terry, kudos on a wonderful event. I can just say for myself, I think this is the fifth or sixth year that this has happened, and I've only missed one. Um, the gala that we have, where he gives out flamethrower awards to heroes in the community who do
Mm.
HIV work
Yeah.
and beyond, is absolutely amazing. And the level of emotion that people bring, because I think what Marvell does wonderfully is he recognizes the everyday warriors that usually aren't going to get the awards, and so it means a lot more to us
Mm.
because like administrations tend not to recognize a lot of the people and the organizations that they talk about. So it becomes very emotional, and I found
Yeah.
myself like crying with each inductee that got a flamethrower award. I was just crying, and then Kevin Tarver. Shout out to Kevin
Shout
Tarver.
out to Kevin Tarver, Bama Boy
I
Blues.
know he was wonderful, and I have to mention that the Counter Narrative Project received a flamethrower award.
We won an award.
Mhm.
Oh, Rayford just, hey, Rayford. Rayford joined.
Yeah.
Nathan Townsend joined. Hey, Nathan.
Hey Nathan.
Richard Hutchinson gave us a wave hand. Hey,
Hey.
Richard.
But yeah, it was a great event. So it left me very full, and we ended it with Darnell Moore. We had kind of a brunch Sunday morning. What was it, gospel or soul brunch, something like that. And we talked about his new book, No Ashes in the Fire, which is out. If you get it, it's fucking brilliant. Pick it up, read it, enjoy it. It's just a phenomenal piece of work,
Well, you
and
know,
he
we're
was
doing
very
a
humble.
discussion of Darnell's
Tonight?
book. Not tonight,
Okay.
but we're organizing, I guess, a book discussion of the book. It's going to be in July. So if you're interested in being a part, let us know. But we're going to discuss Darnell's book
And he will
on,
be
you know,
doing a reading on June 19th, next Monday, actually, at Barnes and Noble. I believe it's the one off Edgewood Plaza. Is that where it is? Off, I don't know what road it is, but anyway, it's Barnes and Noble here in Atlanta. But you should check it out because he's a phenomenal artist, and the book is amazing.
Absolutely. So we wanted to. Well, first, I know that you had a colonoscopy a few months back, I guess,
Yes,
and would you mind sharing the latest
I
story?
think I shared somewhat of an update, but not the full update. So I
Oh,
had
would you
my
mind saying what a colonoscopy is one more time
Yeah,
for people?
colonoscopy is when you turn, and for people of African descent, the recommendation is getting your first screening one at 45 years of age. If you don't have any family members with colon cancer or anything like that, if you just have a regular routine history, that's the time you should probably get screened for it. Everyone else can get it at age 50. Basically, they insert a tube with a camera all the way from your butt, all the way close to your stomach, and they just take pictures and look at
Mhm.
everything. They see if anything's abnormal. What I heard was that they noticed for me everything looked good, but they had one polyp. A polyp is just a small bit of tissue. Some of them can be precancerous. Most of them are benign and don't mean anything. They took a biopsy of it. I got the report back that said everything was negative.
Okay,
So they want me to come back and have a repeat in 5 years. And so I will go back in 5 years. For some people, if it's completely normal, they only have to go back every 10
every
years.
10 years.
So
Okay.
it's a blessing. So I appreciate all the prayers, the love, the shout outs, the affirmation about getting the colonoscopy. It was wonderful to
A
hear
lot of
from.
people have been praying about your butt.
I
So
know, and I love this, Charles Stevens. You understand that? Are we gonna talk about coffee?
yeah.
No.
David's making fun of me because I went a month without coffee, so I completely kicked my caffeine addiction.
And then,
And then this doesn't sound very supportive.
and I'm very supportive. I'm very affirming of you.
And then I'm back on. So I fell off the wagon
Right.
today. So I've
I'm
been
so
drinking.
sorry.
Actually, that's why I fell off the wagon about last week. But I've been drinking lots of caffeine. So but we're gonna take it one step at
I
a
want
time.
you to be happy
Okay.
in your addiction.
So if you've ever tried to give up caffeine, you can imagine what it's like to want to let it go. So And as always, in the comments, feel free to respond, to ask questions, and also to just let us know what you feel. So we talked about that. Let's talk. Okay, so one of the things that I thought we should discuss is penis health.
Okay. Dick
So
health?
we talked about anal health before, and I was like, well, we should probably talk about the other side of things too, so to speak. So, David, would you mind just sharing some insights about how to keep your
penis happy?
exactly?
I'm trying to think of like a few things that we talk about. There's no like penile screening recommendations where the American Cancer Society or another group says, this is what you need to do to keep your dick happy. There are a lot of things that we talk about. And so when we talk about the dick, you're going to talk about testicles as well. So the one thing I guess I can start off with is talking about screening for testicular cancer. So if you're a man between the ages of 18 and 30, about 67% of the cases of testicular cancer happen to men below the age of 30.
Wow.
And usually it's painless. Usually it doesn't hurt at all and people won't have symptoms. But what we try to encourage people to do is that about once every month when you're in the shower, just kind of inspect your testicles. And what that means is not to kind of look at them closely, but between your thumb and your forefinger, testicles are about this big. So you just kind of run your fingers through them, kind of examine it like a walnut or a grape, and look for any lumps or masses or anything abnormal. Do that maybe once a month and you should be fine. If you have a partner or a spouse, have them do it as well, like make it interesting so you can kind of do those things as well. But that's one aspect I think of testicular health. The other thing that I tell people is to masturbate or have sex or ejaculate, because it actually cleans the pipes out. Drinking a lot of water will help as well as far as penis health. If you're circumcised, you probably don't have to worry about a whole lot of things, but obviously washing every day. If you're uncircumcised and still have your foreskin, one of the things we always tell people to do is just maintain proper hygiene, because when you have foreskin over the head of your penis, it's a closed environment. And so any kind of closed environment like that will be more of a medium for bacteria, fungus, viruses. So we've seen in a lot of studies that men who are uncircumcised have higher rates or have a higher risk of getting human papillomavirus, which causes warts, herpes virus. Some studies show it's a higher risk for HIV transmission. So if you're uncircumcised and aren't planning on being circumcised anytime soon, just make sure you kind of pull the foreskin back, wash thoroughly. If you're working out or have a long sweaty day, like do the same thing. Just to make sure you kind of keep everything healthy and happy. Those would probably be the 3 or 4 things that I'd mention.
Just to go back to the testicular
cancer,
I guess, inspection.
Right.
What would be some things that someone should be concerned about if they're checking themselves or their partner's checking them?
There's a lumpiness that you can feel, and I didn't mention this, and it's a great question, because sometimes you can actually have collections of blood vessels. You can have collections of water. You can have a cyst, which is called an epidermoid cyst, where a lot of the immature sperm kind of collect and get walled over. And so it feels like it could be a cancer, but sometimes these things get tender, which is the difference from cancer. So I think with those kind of things, you're just looking for anything that's painful, that feels abnormal, from like a smooth egg or walnut that you would describe as your testicle. Any pain, any swelling is going to be abnormal. So just to pay attention to that. I think in general, what I try to tell people is that if you notice anything that's different from your norm, get it checked out, get it examined. A physician, nurse practitioner, PA can do a physical exam, be an objective observer. They can also do a scrotal ultrasound, where they use sound waves, very similar to when women have babies and they're listening to the baby's heart sound. They use the same ultrasound wand to actually check sound waves. What they try to do is tell whether something is solid or whether it's a cyst in that testicle, or if it's just a collection of fluid, or if it's an infection. There's an infection of the scrotum called epididymitis that sometimes can be caused by chlamydia, gonorrhea, so on and so forth. But usually your balls really like swell up and it's very tender and very painful. But there's a lot of things you can do. But I think for the most part, if something doesn't feel normal to you, get it checked out.
Related, David, I know I haven't, as a Black gay man, heard much about prostate cancer. Like this is not something that in Black gay spaces, right? I don't know if it's something that we'll really talk about among ourselves. So, for our viewers, what should we know about prostate cancer?
So prostate cancer, it does, they notice, occur more aggressively in men of African descent. So all of us should be have our attendance a little bit higher up as far as looking out for it is concerned. And our outcomes are worse too when we get prostate cancer. It's a very slow growing cancer, so sometimes it takes up to 10 years to grow outside of the prostate. And if you think about the prostate, a lot of people say, well, what is the prostate? The prostate is a little organ that kind of sits underneath your bladder. If your bladder's here and this is going down to your penis, prostate sits kind of right here. And what it does is it produces protein, glucose, and produces the fluid part that comprises semen. So the testicles make the sperm. The sperm travel through a cord and go through the prostate. The prostate gives the fluid, the glucose, protein, all that stuff. And then you ejaculate, then you come. So the prostate does that, and sometimes you'll get a cancer in the prostate. And when you have prostate cancer, people don't usually feel it or have any symptoms until it's already spread outside. So a lot of common things, it spreads the lymph nodes in the groin and also spread to the back. So one of the common things that we see with people, especially older men, is that they'll have really searing back pain. And since back pain's so common, a lot of people blow it off and they'll say, oh, it's a muscle spasm. Oh, you have arthritis, this, that, and the other. And then they get an x-ray and they notice that something is eating away at the vertebrae in the lower back. And that's when you know that prostate cancer may have spread. And so the recommendations, I usually go with the American Cancer Society recommendations, which say that if you're 50 years of age, and there's a blood test, I'll start before by saying there's a blood test to check for cancer, and it's called a PSA test, the prostate specific antigen. And what it does is it checks for a specific protein that's in the prostate that isn't found anywhere else in the body. The normal level is usually below 4, and 2.5 is this kind of cutoff that we use. But what we recommend is that when you're 50, you have no family history, you're not of African descent, you usually will start getting this blood test called the PSA probably once every year or once every 2 years. If you're of African descent, or if you have one first degree relative, a father, a son, an uncle who has a history of prostate cancer, you should start getting your screening at 45. And then if you have like one or more or two, like more than one direct relatives, first degree relatives who have had a history of prostate cancer, you want to start getting screened at age 40.
Why do you think Black men are disproportionately impacted by prostate cancer?
I mean, I think a lot of it is social. I don't think they found from a lot of the studies it's not a genetic predisposition. It's kind of one of those things where, because we don't get to the doctor as quickly because of poverty, because of lack of insurance, because of, I know your favorite phrase, toxic masculinity. We don't need to go to the doctor and have somebody sticking a finger up my butt. We won't get checked for it. And so there are a lot of reasons why men of African descent have worse outcomes. But the thing is that we do need to get screened. And because of it's a slow growing tumor, what the American Cancer Society recommends is that when you turn 75, you probably don't need to get screened for it as much, because your life expectancy is not going to be that long at 75. So your cancer treatment could be something like, radiation, it could be surgery, it could be a whole bunch of chemotherapy, it could be a whole bunch of things. I think the take home with prostate cancer screening, and what I would tell all the Black gay men who are there, check your family history, go see a medical provider and have that discussion. It's not a routine screening test recommended by everybody. And when it is recommended, you have to be prepared of what you will do if it comes back and that PSA number is actually elevated. Because at that point, you'll have to look into getting a transrectal ultrasound, which they take a look at your prostate, they go through the rectum. And then if it is cancer, you're thinking about radiation, you're thinking about chemotherapy, you're thinking about surgery. And all of those things have potential complications like impotence, incontinence, where you can't actually hold your urine, and all these kind of things. So the reason why we tell people to have the conversation and think about it before you just go and get screened is because there's a lot of steps that go right after, and a lot of people aren't prepared for all that. And the rates of impotence and incontinence with like surgery and radiation are in some studies anywhere from 30 to 60%. So it's not like it's just like 5 or 10% or that you won't get it. If there's a high likelihood that you will have a side effect from the treatment of prostate cancer. So for those of you that are worried about, uncles, brothers, loved ones, yourself, bring up the conversation and have that conversation with a provider, but it'll be a nuanced one and it'll probably be a long one, but ask a lot of questions because I think it's an important thing to check into.
Have any of you had experience of having a prostate check, and what was that like for you? Do you have any advice for some other folks that might be sort of within the age range that Dr. Malebranche mentioned, please let us know in the
Yeah,
comments.
that would be helpful. The other thing I will mention is that most people go with the PSA blood test
Mm.
now, but before, and as I kind of alluded to, a lot of people didn't want to go to see the doctor for a prostate screening because it involved where the doctor sticks his finger up your butt and he's feeling for the prostate, because it's literally the prostate is right against the rectum. So when the finger goes in, you can actually feel the prostate. The
Mhm.
problem with that's what we call a digital rectal exam, or a DRE test.
Mhm.
The problem with that test is that not every medical provider or doctor can actually feel it. And so everyone is different. So some people will be able to feel the prostate and say, oh, there's a lump there. We need to do more investigation. Other people will be like, oh, it feels normal. You're fine.
Mm.
And it's really operator dependent. So the blood test is a lot more sensitive for it than, say, a finger test would. But that being said, the PSA test also can be elevated when you have a prostate infection, or when your prostate just enlarges as you get older. So those are more reasons why it's not recommended as a great screening test for prostate cancer. But it is something you should ask, especially if you're turning 40 to 50 and you have a family history or of African descent.
Mm.
That's a lot of information I just gave out. I know people's heads are like, "What the fuck?" But there's a lot of information with this.
No, I appreciate it. My father had prostate cancer, my grandfather.
Right.
So I know it's something that I'm obviously in a risk group for.
Right.
So you're saying at 40, I should probably.
Yeah, get screened because it's really slow growing, so people won't know. And so you have to get it checked out. So remember, I think the rule of thumb is 45 if you have one direct family member who's had it, or if you're of African descent. And then if you have two family members, that's really high risk. You'd start at 40.
40. Okay. So go back to our previous topic. Someone asks, how often should you masturbate? Can it ever become a problem?
It's an interesting question. Good question. I'm a firm believer in sexual health, so I think masturbation is a good thing. Um, I think if you're masturbating so much that you're missing work, or not spending time with loved ones, or not doing the things that normally give you pleasure, then that may be problematic. But only you can decide what that norm is. And so the other problem is that if you have a partner, or if you have a husband or someone that you're with all the time, and you're masturbating so much, one of the drawbacks of masturbating a lot is that your dick just gets sensitized to what your hand does. So when another person puts their mouth on it, or when you're screwing somebody else, or when they jack you off, you're like, that doesn't feel good, because you're so used to what you have to do with that. But as far as from a physiological standpoint, the fact that when semen comes out, it flushes out your urethra. And so that's what it does. So there's actually some well-documented health benefits from it.
So continue to flush out that urethra.
Go ahead, flush out your urethra. Do what you need to do. Go ahead and masturbate. We're sex positive here.
Another comment is Rafer says, had both colonoscopy and had the finger test before. Very quick and over before I knew it.
Absolutely.
So that's good. So it sounds like the
Rafer.
colonoscopy isn't. I mean, of course, my first concern would be, is it painful? Is it uncomfortable? But it sounds like it's pretty straightforward.
No, the colonoscopy is pretty straightforward.
I mean, hopefully by the time I have to get it done, they'll have it down to like
a
saliva test or something.
Exactly.
Or
they may
pee in a cup or something.
They may actually. So yeah, but it's not as bad as you think it is.
Or the robots are just going to take over, and then the robots will just do the colonoscopy.
Or they'll just have a body scan that you can just kind of slide through, and it'll detect everything. Yeah, you don't have to do a thing.
I'll take that over self-driving cars, but
okay, fair enough.
Hey, Bernard just joined us. All right, so another thing that we're like all over the place today.
I know we are.
So we talked a bit about penis health, and we talked a bit about prostate cancers more broadly speaking, but we wanted to switch a little bit. This is something that's come up a lot, and we've had a lot of discussion around, which is related to hooking up and hooking up safely, and just understanding that there are at times violent situations that people sometimes might find themselves in like a hooking up context.
Right.
And so we just want to talk a bit about like tips for, hooking up and hooking up safely, particularly if you meet someone on the apps and so forth. So David, you want to start us off?
I can start us off. Yeah, I don't know if there's a necessary rule book with it. I do think that you just have to be as careful as you think it is. I mean, people will have instincts about somebody, acting a little bit flaky, or someone throwing some red flags when you're trying to hook up. And so pay attention to your gut. If something seems like it's wrong, like someone wants you to meet them in a stairwell or someone wants to meet you in this empty lot, like it could be kind of hot, and it could be like, oh wow, this is going to be some freaky shit out here. But it also could be something where you want to make sure you're safe. A lot of people also recommend, I don't know if you've heard this before, about like telling a friend. Like maybe you could screenshot the picture of the person that's on Jacked or on Grindr or on Scruff, wherever you're finding somebody.
Growler,
send it to your Growler.
Adam for Adam, is that still on?
Adam for Adam Radar, I think they call it.
Okay. Just want to be inclusive.
I know. Good job. So, you can do that and then screenshot a picture to a good friend and say, hey, I'm with this person. So if anything happens, if you don't hear from me back, or have a friend check up on you, say, hey, I'm going to hook up, and call me and check in on me later, just in case.
I've definitely heard both. I have a story about. I'm not gonna tell this story.
Tell that story.
I've heard both. I think I've heard both arguments where some people feel like it's safer if they go to someone else's house, and I've heard people say it's safer. They prefer to have people come over their house.
At their house, yeah.
I've
heard both.
Yeah, but I don't know. I'm sort of not inclined to. Intuition. I'm ambivalent about intuition. Right.
You don't pay attention to instinct.
I'm ambivalent, I'll say.
Fair enough.
But I do like the suggestion about letting a friend know where you're going. I think that's really important. I know sometimes it's uncomfortable, right? Like people might feel kind of embarrassed, or they might feel like they don't want people to know what they're up to.
Right.
But have a comment. Randy says, I sent a screenshot to my homegirl and she saw him on Crime Stoppers. Oh, hashtag true story. What? They were on Crime Stoppers.
Wow.
That's what friends are for. At least your friend is a watch. That's why you gotta
And with Google Images, you could look shit up and find out who somebody is. You could do all kinds.
People
of stuff.
actually do that.
Yeah.
Okay, that's a lot of research.
Catfish, they do that all the time. They just do Google Images and find somebody and they go from there.
Wow. Do y'all do that? So have you had the experience where you were gonna hook up with somebody and you Googled I see Johnny.
Johnny is nodding his head.
Wow. Spokio.
Oh wow. So
you Google phone numbers too? Wow, y'all are really
private investigator.
Real crafty.
They're very crafty nowadays.
I remember the 90s, back in the old days of old AOL, the chat, we are on some new.
Well, back in the day, it was AOL chat rooms. It was also Yahoo Messenger, and I remember back in the day, you used to have that attachable camera when cameras didn't come on computers.
Like the webcam.
And you had to plug in the webcam to the USB port, and then tilt it directly to where you wanted it to be seen, and then you go ahead and have a session with somebody over there. Yeah, those were back in the old days. Things have progressed since then.
Randy says Johnny is savvy.
Johnny is very savvy. I think the overall message is just
but do you
be
think,
safe.
So you Google when you're Googling someone or doing Google Images, what are some of the things that you should be looking out for? What are red flags?
A mugshot at a correctional facility?
Well, no, because a lot of considering the impact of the criminal justice system on Black people,
it could be.
But again, it's about whatever your level of confidence. For me, it wouldn't. Well, I'm dating someone, but I don't know that. Maybe it depends on what it's for or whatever. Right. I don't know.
Exactly.
But usually it could be a good conversation starter.
It could. Yeah, you could ask.
Hey. If they didn't know you're Googling them.
So I Googled imaged you and I found that you had a stint in Clayton County Jail.
I feel like that's so much work. So it's just getting ready and prepping and trying to find a cute outfit and getting your, it's also I got to put my team on it. I got to call Olivia Pope and Associates.
But also it's hard. And I remember, and I'll just tell a story. I remember with Craigslist, when I used to use Craigslist, and they've since done away with the personals on Craigslist. But I remember meeting somebody that had this whole history that I did not know about. And we dated for 2 or 3 weeks and then things went off the rails. And then I found out from the local police that, he had a record, and not a record, a lot of records and a lot of stuff going on. And so I think, you don't know what's going to happen. And in this culture of kind of quick hookups, your hormones are raising, you think you're excited and you're ready to go. And then it turns out to be something else. There's no way to predict that. You can do some of these things to try to keep yourself safe. Screenshotting a friend, calling a friend, telling them to call you if they don't hear back from you in an hour.
I was going to tell you, one time I told a friend that this was many years ago, and I forgot to call them and tell them I was
okay, and they freaked out.
They freaked out.
I know they
but I had my phone cut off, so it was.
Oh wow! So they
It was
really
a
freaked
moment-
out. So they couldn't get in touch with you.
Yeah, like I
Yeah.
turned my phone off, and
Right.
yeah, it was a trip. Okay, comments. Anthony, hey Anthony Antoine says Facebook tells their entire story. They're married, they're coupled, they're more out than they say they are. All the tea is spilled on Facebook. Bernard says, we're all adults. Remove the stigma and shame around hooking up. Let somebody know where you're going and with whom. Yeah, I think that's great advice, Bernard.
That is
Anthony.
great advice.
You gotta, I mean, but again, it's like, but do you think for some folks, so much, I imagine around hooking up is also about, about being anonymous, like sort of heightening the, I don't know, the sensation of the experience,
right?
Of like not wanting to know too much.
Yeah, it's like
so I guess for folks that are like on that tip, that kind of want a degree of mystery and the anonymous, like how would they,
the impulsiveness of it, the
how would they keep themselves safe?
I don't know. I think it's hard. I think it's a crapshoot. And so you can try to do these things for a lot of people who just get excited and just want to do so. And everybody knows that when like your hormones are going crazy and you want to hook up, you're not in your right state of mind. So it's really hard for a lot of us to kind of say, well, okay, let me do this. It's hard for people to say, okay, let me put on a condom. Let me do this. Like we lose our minds in all those scenarios. So we don't think about these things that supposedly are going to be quote unquote better for us. So like with this, I just think it's a tall order because you're fighting biology, you're fighting your physiology.
One thing I'll say is that I came out when I was 15,
right?
And I started dating dudes when I was like 15 years old, 16, and I'm so grateful because I had so many older Black gay men in my life that were really ethical and that were, because I think sometimes you tell the story about Black gay men as like predators and that ought to get us, and even in the context of recognizing that there are circumstances in which one needs to be aware. Right. But there's also, I mean, I can say from personal experiences, there have been times when I've put myself in situations that weren't necessarily, for a young person, weren't always, where I wasn't aware of my surroundings, and I wasn't always, that there are people that looked out for me. So I'm really grateful to have had that experience. I also realized people have different experiences, and that's real. But as a community, I think that, I mean, some of it, obviously there's individual agency, but I think as a community, we have to norm safety, and there's some norms. Okay, I see lots of comments. Right. Okay. Michael Anthony says, I suppose I can send a screenshot, a pic, and send the info to my mom's when I'm going to hook up. Nobody will search for me like she would. Yes, that is
not everybody can send
idea.
A screenshot to their moms about that stuff.
Shout out to your mom.
The Wi-Fi. Okay. We had some technical difficulties for a quick second.
Overall, I think the app people must have got mad. Maybe the gods of the
probably the app people got mad that we were dogging them. But I think
we're this isn't about dogging. Right. Ultimately it's about pleasure, and it's about, but we want you to be safe while pursuing pleasure, even if that means being aware. I mean, right. I definitely am a big proponent of community and just. You have a community behind you, but no, this isn't about folks not,
no.
Being inhibited. I mean, I think
absolutely, yeah. Use the apps, and I mean, the apps are a great vehicle, an option for people to meet. It's just a shame sometimes where there's a few people that. And this is always the thing. Like you have a good invention, like something good technologically, and then all of a sudden, one or a couple people ruin it by doing some fucked up shit.
So what are some of your experiences in the comments? Let us know with apps. Like, what are some of your strategies, and what advice would you give? And I'm also thinking about folks that might be newer to, right. Exploring their folks that might be newer to navigating right. the sexual cultures in our community. What advice would you give them? Because I think a lot of us, we don't really get, there's no manual, there's no orientation guide. And a lot of it's just figuring out as we go along.
Well, people told me after I hooked up on Craigslist and I had that problem with that dude, they were like, well, what do you expect? You hooked up on Craigslist.
And I was like, okay, of the hierarchy of
seriously, like, I didn't know there was a hierarchy with that. Like crazy people on Craigslist.
It's very stigmatized. Craigslist is very stigmatized.
It really is. So I didn't realize
Adam for Adam were the ones that were the most stigmatized.
I didn't know it. So I didn't realize that there's like a hierarchy. Like this is the safest one.
I think it's it's really classism though.
I agree so too. I think it is.
It's those fancy
it's homophobia.
It's homophobia. But I think that Okay, so our last subject we want to talk about, we want it to be very broad this evening because we haven't been together in a minute. You know, last week we are in Birmingham.
Right.
I was working behind. David made me work behind the scenes. So today,
I don't know if that's the truth, but yeah.
We wanted to talk. I guess another piece of our community, our culture, our lives that we sometimes find ourselves in uncomfortable situations. It's in the barbershop.
Right.
And I know there isn't really, there isn't like a roadmap. Like, what does it mean to be in a barbershop? And some of us have very great relationships with the bar. I know I have a great relationship with my barber. I love my barbershop. But I know some other folks might have less affirming experiences.
Right.
Some folks might even have somewhat erotic experience. So there's just a variety of different kinds of relationships. But we want to talk about just navigating barbershop culture misconnections. That's what Randy says. So, David, I know you wrote a piece about your experience in a barbershop several years ago for NBC News.
I did.
And I wanted you, if you could just share with
folks.
I
could share that for a moment. When I moved back from Philly, I had a really good barber in Philly for the 3 years I lived there. And then when I moved back, I was working at Cobb County Jail. And I lived in Marietta. So I was trying to find a barber in the area, and I found a local barbershop. And it was around the time when Will Smith's son, Jaden, had started to kind of expand on, his clothing and kind of bending gender norms, this and the other. And people were all going crazy. And so they brought it up, and some of the guys were talking about it, and they started like making all these derogatory comments. And there's always that moment when you're sitting in the barbershop and you're thinking, fuck, do I have to deal with this shit again? And I think almost every Black gay man has had this experience where someone starts popping off with some homophobic shit, and you're just sitting there like, am I too tired to say this? So what I decided to do was do this kind of gender identity, sexual identity 101 with them. So I started asking some questions. Well, what did you feel about this? And why would you say that about this person? Or do you understand the difference between what it means to be gay because he's not transgender? Because they started making comparisons to Jaden, to Bruce Jenner, and now Caitlyn Jenner, and trying to say that these were two analogous things. And I was just like, it's not the same. So I had to and I knew because the barbershop got really, really quiet.
Oh, yeah.
When that conversation started happening, and I could tell like there were people that were getting their hair cut across from me and on the side of me, and the barbers were just kind of like, and things got real tone for that. But then there were a couple brothers that came over and started asking more questions. And then I had to explain. And one of the things that I can do is I'll try to like, make it so like I'm a physician, so I work with transgender kids all the time, and I said, so this is what I've experienced, and yes, they're not trying to be this, that, and the other. This is who they are. I just don't like them putting their agenda on me. And I was like, well, how are you putting your heterosexual agenda on them if you're transgender?
So you're able to move the needle.
I moved the needle. I flipped it back on.
So what happened when you came back the next week? Did it shift the culture of the barbershop? Or?
No. It was fine. I mean, there were different people there, obviously, but my barber was fine. He was cool.
But what about? So yeah, I had a moment at a barbershop where I was and please be advised, I'm about to use some triggering language. Well, I was in a barbershop and I was getting my hair cut, and one of not my barber, but another barber was talking to, like, he was joking with, I guess, one of the other people in the shop. And, something, ended up calling the dude in a joking way. He called him a faggot. And I stopped the show.
I know you did.
And I so I didn't go into my workshop space. I wanted to do not say that word. I just completely went off.
What did they do? How did they respond?
They got really uncomfortable. They got really quiet. I think they were more. I feel like I think they felt like the space had been transgressed in this way. Like, how dare you challenge? It was because they didn't know what to do with it, and I know they wanted. And of course, they wanted to say something back, but they were like, I know, it was such an.
And you were probably so angry that they didn't want to fuck with you at that point.
And then I shifted. Like, once I, expressed to them that it wasn't okay, that I'm not comfortable with that you don't use that language there. And then I was like, okay, we'll carry on, because then it got real quiet and uncomfortable, and then that was annoying me. So I was like,
talk about basketball. Yeah, y'all
move on.
Talk about LeBron.
But and after that, after that, it's like, and I'm sure there were probably some other conversations.
Yeah, what happened afterwards when you came
when
back?
I would go, like, there was no more. I didn't hear the word faggot anymore.
Right.
Well, I never. It wasn't. That was the first time I had ever heard it. Because when I go into, when I used to go to barbershops, it was like going to war. It's like, you go in, you're very aware, and I also felt a sense of responsibility. I mean, I know many of us go into those spaces and we shrink, and many of us go into those spaces and we don't feel safe, we don't feel empowered, we don't feel comfortable challenging stuff. So sometimes we just kind of let it slide, or we may kind of do the thing where it's like,
Right.
I'll challenge it next time,
Right,
or
right.
you know, sort of a calculated thing. But for me,
Right.
I felt strongly. And again, I'm not trying to say what people should do. I'm just going to talk about what felt comfortable
Right.
for me.
Right.
But you know, for me, it's a situation of, you know, I don't want to beat myself up later for not speaking. And also, like, that just isn't. I mean, since I've been out, pretty much, you know, I just felt like it's important for me to speak up. And I actually haven't, in the times I have been in barbershop settings, I have spoken up about if something went down.
Right.
I personally haven't had a negative experience.
Right.
And I'm also clear that other people are watching, and
Right.
I think that, you know, part of it is thinking that, you know, maybe other people might feel more compelled to, because I don't know if we always know what's possible for us. Like, no, we should speak out.
Yeah.
But see lots of comments.
I know. You knew that was gonna happen.
Bernard says, many years ago when I lived in Albany, New York, I was in the barbershop and they had Jerry Springer on the TV. The show had a transgender person who tricked. Okay. So Bernard saying that the level of homophobia ratcheted way up to the point of making me feel unsafe. Yeah, I imagine a lot of us feel very unsafe in barbershop environments. So, I mean, again, I'm not by any means saying that I mean, it's ultimately what you feel comfortable with, or what, I mean, it's a personal choice ultimately.
But someone also brought up the point to me, and it depends on kind of who you are, and also your gender and masculine performance, and deciding, because that will trigger how comfortable they feel in these settings, and if they'll probably listen to you or something that happened. Because someone said to me, like, well, they probably assumed you were straight, and so they thought, you know, they would just say this stuff, and then you saying something back would be different from someone who had a more femme performance to be able to say that. So people were trying to,
but
like,
see, I think that actually, I believe that they don't, wherever you are on the gender spectrum, I just think they assume you won't speak up.
You won't speak up no matter what.
So I mean, maybe part of it is that they might have made some assumptions,
right?
But I also believe that they pull it.
I agree.
You know, because I've had friends share stories about being in barbershops and their gender expression
is more feminine, yeah.
And you know, and it still happens. I just think they assume that if you're gay, you're just not going to talk about it, or you're not going to challenge them. I think a lot of them have never been challenged before about homophobia. I think for a lot, you know, I think it's just a new terrain. See, Ivan joined us. Hi, Ivan.
Hey, Ivan.
Anthony says, "Oh my God, I just had a barbershop experience today. Homophobia is sold in the soda machine. It's not easy to navigate, but I'm me wherever I go, even at the barbershop.
That's right.
But I mean, I also feel like, you know, maybe there is a discussion around. I mean, is it that men that present more, that are able to assimilate better into that space? Is it that they feel, are they more comfortable speaking up? I don't know. I think it's, but again, I don't. I realize that there are many ways to be subversive. There are many ways to resist." We're not trying to prescribe there's one right way to challenge. I mean, they're different. I mean, even if you just choose not to go back, I mean, me personally, I'm not paying someone to oppress me. Like, I'm just not going to give you money, and I'm not going to pay money to be in the space. And barbershops are too, you know, haircuts are too expensive. Like, I'm not going to pay you to oppress me. But I also realize that, you know, it's, people have different experiences, so we want to hold space for that. I mean, it's a journey.
Yeah.
You know, I think so often we forget that it's a journey. And I mean, I know for me, there are times, particularly when I was much younger, there are times when I didn't challenge stuff, or I didn't feel, you know, I was afraid, quite frankly, or just didn't feel comfortable. So, you know, it's all a journey, and we have to just meet people. Because I also don't want to be on the side of, if you don't challenge something, or if you don't stand up for yourself, something's, you know, I mean, it's, you know, we've all been there, you know, but ultimately the goal is to create a community where when people are ready, when they do move along the journey, that they know we got their back.
Yeah, I think at the end of the day, there are always people watching. And so it is one of those things that if you don't speak up, and what'll happen is that there'll be one of those days, and I've had this situation happen a lot, whether it be kind of some racial shit that went on, and I'm the only one that speaks up. Someone invariably comes to you at the end of it and says, "Man, I was thinking the same thing. I was just about to say that. I'm so glad you spoke up, because I was about to say that. I was about to come for them. So I'm glad you did it." And I'm like, yeah, sure. But you realize that if you don't say it, who will?
Who will, yeah.
If you won't speak up, who will at that moment? So it's a lot to put on us when we're dealing with a lot of other shit, that we have to be the, you know, the purveyors of political correctness, or to say to somebody like, "Hey, that's really messed up, and that's harmful, and that's violent, or that's just not appropriate, or it's not cool, or I'm not going to tolerate that." But it's something where you never know who's watching. You never know how many of those barbers may be same gender loving, how many people that are patronizing that establishment become somewhat empowered, or say like, yeah, that's,
one of my most remarkable experience. I had this was many years ago, and this was many years ago, and I was in a barbershop, and this is like before marriage equality was, the law of the land.
Right.
And the barber asked me something about if I had a girlfriend or was trying to engage me around like my romantic life or something. And I was like, no, asked me if I was married. I think that's what it was. And I said something like, oh, it's not legal for me to be married. And we ended up having this discussion about.
That's a nice way to say it, right?
Yeah.
And open that up.
And he was acting so shocked and like, oh my God, I can't believe and I was like, so you do realize you have customers that are gay,
right.
But he was like, yeah, but they don't talk about it. They don't say it. So he was really shocked. Johnny, I saw that what were you holding up? Was that a comment?
Time to wrap up.
Yes.
Okay. He was like, wrap it up.
Was there a comment?
No, this wasn't a comment. This was more of a statement. Because I'm actually on here. But talking about the importance of making sure that we stand for, creating spaces that are non-transphobic and non-homophobic,
right?
Wherever we are. I think that's important. It comes down to our language.
It does. Yeah, Johnny made a good point about, if you guys didn't hear him, about creating spaces that are non-transphobic and non-homophobic. And I think it's up to us to kind of create. So, and it's only you only need one person to kind of create that. Because I know you shut that shit down when you got angry at that, because you only need one person to kind of shut that down, and then people will start to think. So if you think one person, you can't have power to do that, you're absolutely wrong.
And part of my issue is, I'm so clear that we stand on the shoulders of giants, and
Absolutely.
Because people fought and put their bodies and lives on the line, it makes it possible for me to exist and move through the world.
Right.
So I feel a sense of responsibility. Like
right.
I have to fight,
right.
And be resistant, because I owe it to Essex Hemphill and Marlon Riggs.
Absolutely.
And people, Bayard West, like all these people that were fighting those fights when they could have easily been locked up, put in jail just for who they love, or murdered. And certainly I know that those realities exist today.
Right.
And I'm not trying to make some argument about progress, but the reality is, I felt like this amazing sense of responsibility. Right. Some comments. Rafer says, it has been an interesting, as they all know, in our shop, that Kelly and I are a couple. Even wore my campaign buttons when I ran. In our barbershop is straight and accepting. Being visible is that it's okay with you is the only way we get counted. Absolutely, visibility is power. Thank you, Rafer.
Right.
Jamel says, secretly, I kept my locks for as long as I did because I had a great anxiety around going to the barbershop.
Wow.
I was so uncomfortable with my identity. I certainly am not oppressed in that way any longer. Thank you for sharing that, Jamel. Yeah, thank you for sharing that. Well, Johnny's telling me it's time to wrap up. So I guess we should sort of wrap things up. Alvin. Oh, thank you, Alvin. Alvin's our camera, sort of holding it down in the back. Alvin and Johnny, two of our amazing counter-narrative brothers. Thank you. Love you guys. But I definitely want to say a few things. One, like us on Facebook. If you're watching us on Facebook, subscribe to our YouTube channel if you're watching us on
YouTube.
Join our email list at thecounternarrative.org. And I also want to add, if you haven't registered to vote, please register to vote. And if you have questions about how to register to vote, please reach out to us and we'll help you navigate that system.
Amen.
All right. So next week, we're actually going to be on
Monday.
We have a special guest, but we're going to keep it quiet. We're going to keep you in suspense until we announce.
You want to talk about the topic at least?
You talk about it.
We're going to be talking about raw sex. So we're going to kind of dive into...
a deep dive, so to speak.
A really deep dive into raw sex. I can't with Charles right now. A deep dive into raw sex and just about kind of the social, political, cultural... pleasure dynamics, everything around raw sex. And we're going to have a special guest who has dedicated a lot of his work around examining that, particularly among us as Black gay men.
What if we get like protests? Like, are people gonna?
It doesn't matter.
Are there gonna be picket signs?
We're gonna talk about it no matter what. But tune in next Monday at 7 p.m. for a very special counter narrative revolutionary health episode.
Thank you all.
All right, bye.
See you next Monday.